Okay, guys. So, for today, our topic is all about pain and inflammation. So, before we start our lesson, matanong ko lang kayo. Okay, is pain good or bad? Kailangan pa natin ng pain? Okay, I guess most of you would answer no. Kasi nga naman, pain can be very debilitating. Okay, minsan pag may sakit, hindi ka makaperform ng maayos. Tama nga ba? Okay, so most of us can relate to this because once in our life, we have experienced pain. It could be either physical pain, nasaktan ka physically, or it could be emotionally. Okay? So, nasaktan ng iyong puso. Now, back to the question. Is pain good or bad? Okay, so sabi nga natin, it's bad because it can be debilitating or hindi ka makakilos ng maayos kasi you are in pain. Okay? Katulad halimbawa, pag heartbroken ka, okay, kaya mo ba mag-perform ng maayos sa school task mo? Okay, makakapag-aral ka ba ng maayos para sa quiz natin? Kung ikaw ay heartbroken? So most of the time, hindi because you are in a state of pain. Okay, and that is an emotional pain. Now, however, kung walang pain or hindi tayo nakakaramdam ng pain, hindi natin malalaman kung may mali ba. Tama nga ba? Halimbawa, sa isang relasyon, okay, kung nakakaramdam ka ng sakit, ibig sabihin, may mali. Okay? So, ibig sabihin, may dapat magbago. Now, in the case naman sa katawan natin, importante ang pain. Why? Because through pain, we are able to identify which part of the body is, halimbawa, damage or may mali. Okay? Now, let's answer the question, what is pain? So, pain is an unpleasant sensory and emotional experience. So, again, let me repeat that. Pain is either physical or emotional, associated with actual. When we say actual, this has already happened. Or potential, okay, mangyayari pa lang, tissue damage resulting from the activity of the nervous system that results from the stimulation of the nociceptors. So, when we say nociceptors, these are what we call the pain receptors. Now, sinabi natin, pain can be actual, meaning nasaktan ka na, okay? Or pwede namang potential. Halimbawa, may nakita kang tutusok sa'yo. Okay? Di ba, bago ka pa natusok, alam mo nang masakit yon. Kaya ano ginagawa mo? Iniilagan mo yung source of pain. Okay? Now, what happens ba kapag merong pain? Okay, so let's have this for example. Right? So, itong isang daliri natin, pakiramdaman mo halimbawa ang dulo ng isang pako. Okay? Now, if you notice, ang graph natin sa my left side, you have their time versus stimulus. Stimulus sa y-axis, time na sa x-axis. Now, you can find here pain threshold. Now, what is pain threshold? This is the amount of stimulus you need to reach to feel pain. Now, kunwari, pakiramdaman mo lang ang tip ng pako. Okay? Now, normally, you won't feel pain, right? Mararamdaman mo yung dulo ng pako, pero wala kang mararamdamang sakit. This is because you have not reached the pain threshold. Okay? Now, most of the time, ang naramdaman mo lang is the tactile sensation, which is because of our mechanical receptors. Now, kunwari naman, paano kung yung pako na yan, itinuhog ko sa aking daliri? Now, obviously, makakaramdam na ako ng pain because ma-reach ko na yung pain threshold. Now, when pain threshold is activated or na-reach mo na yan, kaya ang ma-activate na ngayon ng receptors is what we call the nociceptors or the receptors for pain. Now, let's see. What happens really when you start experiencing pain? Now, kapag natuhog ng daliri mo, kunwari lang okay, natusok ang daliri mo, so there are damages sa ating cells. Now, specifically, okay, ang nadadamage dyan would be the cell membranes. Now, once cell membrane is damaged, it produces prostaglandin. Now, hindi lang naman prostaglandin dito ang involved. Involved din naman ang substances like bradykinin, substance P, especially substance P. That's the substance for pain. Okay, hydronium ions, serotonin, ATP, histamine, which I will be highlighting more on inflammation, CGRP, and lactic acid. Now, whenever we damage cell membranes, it releases arachidonic acid, which in turn creates, prostaglandin. Now, please take note, guys, prostaglandin does not really cause pain. Pero ang ginagawa niya is, it simply decreases the pain threshold. So, kanina, di ba, para maramdaman mo lang ang pain, kailangan na ituhog yung pako. Pero pag binabaan ko ang pain threshold, a simple touch can already create pain. So, nagets mo ba? Kaya nga minsan, di ba, pag, halimbawa, ginalaw ka lang. Okay, halimbawa, pinindot yung daan mo, yung braso. Okay, di ba sabi mo, aray! napapaaray ka. So that could mean that you have high levels of prostaglandin. So maliwanag ba tayo? So again, prostaglandin does not necessarily induce pain, but it just simply decreases the pain threshold. That's why you can feel pain when you just simply touch some part of your body. Okay? So like halimbawa, sumasakit ang ngipin mo. Okay? Pag ginalaw konti yung ngipin mo, di ba masakit? As in, halimbawa, mamagay yung ngipin mo, so galawin mo lang siya ng konti, ramdam na ramdam mo yung sakit. And that's because of prostaglandin. Okay? Now, again, what's the receptor involved in pain? That would be the nociceptors. Now, when this prostaglandin, the prostaglandin binds the nociceptor or bradykinin, substance P, etc., okay, it creates electrical impulses. Now, kapag yung prostaglandin nagbind sa nociceptor at naging electrical impulse, we call that the transduction process. So, when pain stimulus is converted to electrical energy, this stimulus will travel across the nerve fiber. Okay, so this is the nerve fiber going into the spinal cord. So, maliwanag ba tayo? Okay, so again, yung pain na naramdaman or na-sense ng nociceptor, na-convert siya into electrical impulse through the transduction process, and it is traveled through the nerve fiber going to the spinal cord. Now, pagdating sa spinal cord, what connects the nerve fiber to the spinal cord is what we call the dorsal root ganglion. Now, the dorsal root ganglion takes the pain stimulus from the nociceptors going to the brain, specifically to the thalamus. Now, the thalamus in the brain is responsible for the interpretation ng pain. Okay, maliwanag ba tayo doon? Okay. Now, kung ang nerve fiber mo is myelinated, okay, may myelin sheath, okay, this is what we call the alpha-delta fiber. Okay, so let me repeat. Kapag ang nerve fiber covered siya ng myelin sheaths, okay, that is known as the alpha-delta fiber. Now, this nerve fiber is responsible for the sharp pain na nararamdaman natin. Now, what usually causes sharp pain? Halimbawa, natusok ka ng karayom, nahiwa ka ng kutsilyo. Okay, so those are sharp pain. And when you start feeling sharp pain, okay, ibig sabihin nun, ang na-activate is the alpha-delta fiber. Okay? Now, another type of nerve fiber involved in pain, okay, is the unmyelinated sheath, okay, which we call the C fiber. Now, the C fiber naman, dahil wala siyang myelin sheath, it creates dull pain. Dull pain, halimbawa, sakit sa ulo. Okay? Sakit ng tiyan. So, those are dull pain. So, ano nga ba class ang purpose ng myelin sheath? Di ba, ang myelin sheath is responsible for increasing or improving nerve impulses. So, mabilis mong mararamdaman yun. Kaya nga pag natusok ka ng karayom, ang bilis mong nararamdaman. Tama ba? Now, pasalamat tayo dun sa myelin sheath natin. Now, kapag sumasakit ang ulo natin, agad-agaran ba natin itong nararamdaman? Hindi naman, di ba? Kaya dahan-dahan natin nararamdaman ang sakit ng ulo. And it's because C fiber ang ginagamit doon ng katawan natin, which is unmyelinated. Right? Okie dokie. So now, from the nociceptor going into the spinal cord, okay, so nagta-transfer na tayo ng electrical impulse. Now that process is known as the transmission process. Okay? So now, mula naman sa spinal cord, kailangan makarating ang nerve signal na yun to the brain for interpretation para maramdaman natin na, uy, may sakit nga talaga. Okay? So, what connects the spinal cord to the brain is actually the dorsal gray horn. Okay? Now, yung dorsal gray horn na yan, okay, is considered as the gateway for pain impulses to reach the brain. So, meaning, para makarating ang pain impulse na yun na galing sa dorsal root ganglion, okay, kailangan niyang dumaan sa dorsal gray horn. So, maliwanag ba tayo doon? Now, kapag ang signals from the dorsal root ganglion dumating sa dorsal gray horn, okay, aakyat na yan sa brain, specifically going into the thalamus for interpretation. Okay? So, ang sabi nga nila, the dorsal gray horn is considered to be the gateway for pain. So, meaning, you can only feel pain if the dorsal gray horn is activated. So, meaning, if I don't activate the dorsal gray horn, I won't feel any pain. And that's how anesthetics work. Anesthetics work by blocking the pain impulses going into the dorsal gray horn. So, are we good there, class? Okay, I hope so. Okay, so the thalamus is the one that interprets and perceives pain. Okay, and this is known as the perception process. Okay? Now, mula sa nociceptor, paakyat ng brain, ang tawag natin doon is the ascending pathway of pain. So, are we good? Okay. So, now, minsan, okay, sobra-sobra na yung pain na nararamdaman natin. Tama nga ba? So, syempre, pag sobra-sobra man ang pain, hindi na tayo makaka-function. Hindi naman papayagan ng katawan natin na forever ganon, na forever kang nakakaramdam ng pain. Okay? Now, that's the reason why, okay, when there is too much pain, a specific area in the brain known as the periaqueductal gray area is activated. Now, kapag nakasend siya ng, sabi niya, hala, sobra-sobra na ang pain na nararamdaman mo, okay, it starts producing endogenous opioids. Now, these endogenous opioids come in the form of endorphins, enkephalins, and dynorphins, which we'll discuss more as we go on. So, anong ginagawa ng endogenous opioids na to? They block the signal transduction sa dorsal gray horn natin. So, ibig sabihin, hanggang saan na lang ang pain signal? Hanggang spinal cord na lang. Now, kapag ang pain signal hindi umakyat sa brain, hindi mo siya mararamdaman. At yun ang ginagawa ng endogenous opioids natin. So, meaning, ang pain hanggang spinal cord na lang. Hindi na makakarating sa thalamus for interpretation kapag merong endogenous opioids. So, it prevents the transmission of pain to the brain. Okay? So, this process is known as the modulation process. The modulation process. So, actually, class, pain pathway is more complicated than this. So, I am just trying to simplify it so that we can better understand this as, okay, para mas mabilis natin maintindihan yung lesson natin. So, okay? Okie dokie. Now, from the periaqueductal gray area, pababa siya ng spinal cord. Okay, so this is what we call the descending pathway of pain. Right? So, how do we manage pain? Okay? Now, we can manage pain through acupuncture. Okay, I guess everyone is familiar with this. Acupuncture, yung maglalagay ka ng mga needles in specific areas of the body. Now, specifically, if you want to manage pain using acupuncture, you put needles along the spinal cord. Okay? Now, when acupuncture is done properly, it can cause the release of endorphins and enkephalins. So, ito yung endogenous opioids na meron tayo, which can inhibit pain production. So, are we clear? So, basically, if you use acupuncture, you are activating the descending pathway of pain. Now, another way of managing pain is, okay, through tactile sensory signals. Now, class, naramdaman nyo na bang mabukulan? Okay, halimbawa, nauntog ka. Okay, nauntog ang ulo mo. So, kapag kauntog mo, di ba ang ginagawa mo is hinihimas mo yung area na nauntog? Now, bakit kapag hinihimas natin, feeling natin parang nababawasan ang pain, tama ba? Okay, parang mas konti yung naramdaman mong pain. Now, it's because when you start rubbing yung skin or yung area na na-damage, okay, instead na yung nociceptors ang mag-send ng signal, yung mechanical receptors yung nagsasend ng signal. So, kumbaga, yung paghipo mo sa bukol, right, ang gagana na receptor doon is the mechanical or the tactile receptors, hindi yung nociceptors. So, therefore, ang dumarating na signal sa brain mo is yung himas mo, hindi yung pain. So, nakikipag-compete yung paghimas mo sa pain na pinoproduce ng bukol mo. So, rubbing the skin near painful areas and sometimes applying liniments, di ba mainit yung liniment, often relieves pain. Now, this is due to the stimulation of the alpha-beta sensory fibers from the peripheral, take note of this tactile receptors. So, are we clear? So, the tactile receptors, kapag na-activate siya, depresses the transmission of pain signals via the nociceptors. So, kumbaga, nakikipag-compete yung tactile receptors sa nociceptors. Now, kapag madalas mong hinihimas yung bukol, ang tendency is na-overwhelm yung pain receptors. So, mas nare-recognize ng thalamus yung tactile receptors mo. Or yung signals na pinoproduce ng tactile receptors. So, are we clear with that? So, I hope we're good with that kasi nakakatuwa yung topic na to. Okay? No, sabi ko nga napakaganda talaga ng pagkakagawa sa ating katawan. Right? Wherein, see, sometimes simpleng himas, okay, hihimasin mo halimbawa yung bukol mo, nawawala yung pain. It's because nakikipag-compete yung pakiramdam ng himas ko sa pain na dapat nararamdaman ko. Okay? So, ang main topic natin for today, of course, is how to manage pain pharmacologically. So we can use two types of drugs here. So we can use NSAIDs and then we of course have the opioids, opiates, or opiopeptines. Now, NSAIDs are medications or drugs that inhibits the ascending pathway. While on the other hand, opioids naman activates the descending pathway. So, see the difference, class? Okay, NSAIDs, iniiwasan niya yung pag-akyat ng pain signals papunta sa brain. While on the other hand, yung opioids naman, ini-enhance niya yung, or pinaprevent niya yung no, sorry. Okay, ang opioids naman, activates the descending pathway okay, so it activates the endogenous opioids that we have. Okay, so kapag bumaba yung endogenous opioids, it prevents the pain transmission from the dorsal gray horn going into the thalamus. So, okay? Okie dokie. So now, let's have a few different definition of terms or differences between opioids, opiates, and opiopeptines. Pag sinabi nating opioids, these are drugs with morphine-like activity. Now, they can be naturally produced or synthetically produced. So, basta any drug with morphine-like activity, so that's classified as opioids. Now, opiates naman, ito naman yung mga gamot na galing sa opium poppy. Okay, normally in powder form. And then opiopeptines are the endogenous opioids that we have. So these are the naturally occurring opioids in the brain. So specifically, they are the endorphins, enkephalins, and dynorphins. So in times of stress and extreme pain, so the body can produce its own opioids in the form of opiopeptines. Okay, so that's endorphins, enkephalins, and dynorphins. Okay? So for today class, ang main discussion natin will be about the opioids. So, how do opioids work? Okay, now opioids are believed to mimic the effects of the opiopeptines, okay, which is the endorphins, enkephalins, and dynorphins, by interacting on the opioid receptors. Now, we have 3 opioid receptors. We have the mu, sigma, and kappa. Parang frat lang, no? Okay, now, anong ginagawa ng mu, kappa, at saka sigma receptors? Once the mu receptors are stimulated, it causes spinal analgesia. So meaning, it prevents, when mu receptors are activated, it prevents the pain signals to travel from the spinal cord going into the brain. So are we clear? So therefore, wala kang naramdamang pain. Now, other than that, mu receptors can also cause respiratory depression. Now, when we say respiratory depression, pinapabagal niya ang paghinga mo. So maliwanag ba tayo? So, hindi niya pinipigilan necessarily ang paghinga, pero pinapabagal niya. So, halimbawa, ang normal respiratory rate natin is 20 breaths per minute. Now, if your mu receptors are activated, pwedeng bumaba ang respiratory rate mo to 5 breaths per minute or lower than that. So, isipin nyo na lang, 5 beses ka lang humihinga sa loob ng 1 minuto. So, are we good? Okay. So next one, when mu receptors are activated, it causes sedation. So we all know that. Na kapag gumamit ka ng morphine, inaantok ka. Pero one thing that most drug addicts love about opioids is that it causes euphoria. And this euphoria is attributed to the activation of the mu receptors. Euphoria means feeling of extreme happiness. Kaya ang daming taong na-addict sa morphine because it makes them happy. Now, the euphoric part here plays a vital role in addiction. Okay? So, other than that, the mu receptors can also cause a decrease in GI transit. So, kapag bumagal ang galaw ng intestines natin, it could lead to constipation, which is another major side effect associated with opioids. It always causes constipation. So, if you have a patient class who is on morphine, you can always suggest for laxatives such as Dufalac or lactulose because expect mo na, ang taong nasa morphine, mako-constipate yan. Okay? Now, another effect of activating the mu receptor is that it causes pupil constriction. So, yung pupils mo, nagko-constrict. Right? Lumiliit yung ating pupils. Now, that is because of the activation of the mu receptors. Now, the pupil constriction is actually a determinant kapag na-overdose ang isang patient sa morphine. So, kapag sobrang liit ng pupils niya, sometimes to the point na tinatawag nating pinpoint pupils, okay, a doctor can infer or can have a good guess na nag-overdose ang taong ito sa morphine. And then, of course, lastly, the mu receptor is the one responsible for the physical dependence. Okay? Now, the next receptor naman na involved is the sigma receptor. So, ano naman ang ginagawa ng sigma receptors? If activated, it also causes spinal analgesia. Now, not only that, kapag na-activate ang sigma receptors, it also causes hallucinations. Kaya kapag gumamit ang isang tao ng morphine, okay, sometimes they do tend to hallucinate. Just like my grandmother. Nagkaroon siya ng slip disc. So, hindi kayang i-manage ng paracetamol yung pain niya, binigyan siya ng morphine. So, naalala ko noon, yung grandmother ko, sinasabi sa akin, anak, buksan mo na yung gate, andyan na ang lolo mo. Okay, so ako naman kinakabahan kasi sabi ko, si lolo, matagal nang patay. Okay, so she was starting to have hallucinations because of her morphine. Alright? And then lastly, okay, last of the opioid receptors, we have the kappa receptors. Now, ang kappa receptors naman, okay, its effects are unclear, but it is also believed to cause analgesia and psychomimetic effects. Psychomimetic meaning it also contributes to hallucination. Okay? Alrighty. Right, so now let's talk about the different drugs under the category of opioids. So the opioid analgesics. So it's divided into 5. Okay, so we have the strong opioid antagonist, the weak opioid antagonist, mixed agonist, antagonist, or partial agonist. And then we have the opioid antagonist, and then we have the others. Okay, so now let's first talk about the strong opioid agonist. Now, under this, of course, the main drug is morphine. So, kumbaga, benchmark ng lahat ng opioids is morphine. Okay? Now, other strong opioids includes hydromorphone, oxymorphone, levorphanol, and heroin. Now, if you notice, hydromorphone is 8 to 10 times much stronger than morphine. Okay? Oxymorphone is 6 to 8 times. Levorphanol has the same analgesic effect as morphine, and heroin is 2 to 4 times more potent than morphine. Now, hydromorphone, guys, okay, works similarly to morphine. So, actually, lahat naman sila hydromorphone, oxymorphone, levorphanol, heroin. So, lahat ng ito works similarly with morphine. Now, let's highlight heroin. Heroin ang alam nating pinaka-ginagamit na recreational drug. Now, heroin is more lipid-soluble, hence it works faster than morphine, and it causes greater euphoria. Kaya most drug addicts love using heroin. So, how do they use this? Usually, they use this intravenously. Okay? So, the next group of strong opioid drugs are the fentanyl group. Now, tingnan nyo naman, class, kung gaano ka-potent ang fentanyl group. Okay, so fentanyl groups are often given via intravenous route and is usually used as a pre-anesthetic or intraoperative drug. So, ibig sabihin, bago ka operahan or habang inooperahan ka, ang analgesic na binibigay sa iyo is fentanyl. Now, bakit nila gusto ang fentanyl? Kasi tingnan nyo naman, it's very potent. And at the same time, mabilis siyang mawala sa system. So, it has a shorter duration of action as compared to morphine. Okay? Now, fentanyl is mainly used for cardiac surgery for the reason na it does not affect the heart. Now, actually, hindi lang naman ang fentanyl ang ginagamit for cardiac surgery. So, morphine can also be used. So, these are the primary anesthetic used for cardiac surgery because it causes minimal heart depression. So, may effect man siya sa heart, yung morphine at saka fentanyl, pero very minimal. Kaya kapag operahan ka sa puso, madalas na gagamitin sa yung anesthetic is morphine or fentanyl kasi hindi niya inaapektuhan ang puso. Okay? And then lastly, okay, for the strong opioid agonists, we have methadone and meperidine. So methadone, almost similar ang effect niya with morphine, while meperidine is only half that of morphine. Now, methadone is actually used for morphine or heroin withdrawal. Halimbawa, nag-inaddict ka sa morphine or sa heroin na gusto mo nang tumigil, okay, ang madalas na ibibigay sa iyo pamalit sa morphine or sa heroin would be methadone. Now, bakit ginagamit ang methadone sa cessation of morphine and heroin? So, methadone has less withdrawal effects as compared to morphine and heroin. Hence, it is easier to use when tapering the dose down. So, kumbaga, kung sakaling ma-addict ka man sa isang opioid, mas okay nang ma-addict ka sa methadone kaysa sa morphine. Kasi sa methadone, lesser ang withdrawal effects as compared to morphine or heroin. But of course, I'm not saying na mag-addict ka in the first place. Okay? So are we clear with that? Now, as for meperidine naman, meperidine is mainly used for post-anesthetic shivering and can cause serotonin syndrome. Okie dokie? Okay. So, next drug naman are the weak opioid agonist. So, under this category, we have codeine, oxycodone, and hydrocodone. Now, if you notice, ang kanilang analgesic effects or yung kanilang potency mas mahababa as compared to morphine. Okay, kaya siya classified under weak opioid agonist. Now, codeine, oxycodone, and hydrocodone are partial opioid receptor agonists used only for moderate pain. Now, as for strong opioids, obviously, you can use this for severe pain. But as for weak opioid agonists, they can only be used for moderate pain. Now, these drugs are associated with less respiratory depression than morphine and have lesser dependence liability. So, meaning, lesser ang chances mo na maging addict kapag pag gumamit ka ng codeine, oxycodone, or hydrocodone. So, are we clear on that? Pero hindi ko sinasabing hindi ka na magiging addict sa mga gamot na to. Okay? Now, most of the time, weak opioid agonists are in combination with other NSAIDs such as codeine, sometimes it's combined with paracetamol, oxycodone, sinasabay with aspirin, and hydrocodone is combined with paracetamol. Now, sino sa inyo nanonood ng House MD? Now, if you do watch it, kay si Dr. House, addicted siya sa Vicodin. Vicodin is a combination of hydrocodone and paracetamol. So, still, you can create addiction sa mga weak opioid agonists. Kasi in the first place, it's still an opioid. Okay? Okay. So, next group of drugs are the mixed agonists or mixed agonist, antagonist, and partial agonist. Okay? Now, we have here buprenorphine, pentazocine, nalbuphine, and butorphanol. Now, these drugs are mainly used for moderate pain and produce modest respiratory depression. So, meaning, at least hindi siya kasing heavy ng sa morphine. Okay, they also have less abuse liabilities. Okay, now, buprenorphine is a partial agonist at opioid mu receptor and an antagonist at kappa receptors. So, let me repeat ang buprenorphine, okay, is an agonist at the mu receptor. So, meaning, it mainly causes spinal analgesia. Okay? At the same time, it's an antagonist at the kappa receptor. So, meaning, it prevents psychomimetic effects. Kaya pag gumamit ka ng buprenorphine, okay, it can cause dependence, it can cause respiratory depression, but at least it causes less hallucinations. Okay? Wala rin naman siyang effects sa sigma receptors. Okay? Now, on the other hand, pentazocine, nalbuphine, and butorphanol are kappa receptor agonists with partial agonist or antagonistic activities at mu receptors. Now, kapag So, kapag gumamit naman ako ng pentazocine, nalbuphine, or butorphanol, pwede naman ako magkaroon ng hallucinations. Pero dahil most of these drugs also have antagonist, okay, most of these pentazocine, nalbuphine, or butorphanol have antagonistic activity at the mu receptors, lesser ang chances ko of getting respiratory depression. Okay? So, nalbuphine is mainly used for the pain management of MI patients. So, just like morphine and fentanyl, it has less effects on the heart. Okay? Now, the rest, buprenorphine, pentazocine, at saka butorphanol, wag na wag niyong gagamitin for MI patients. So, amongst this, nalbuphine lang ang pwede. Okay? So, I hope we're good with that. Alright. So, next group of drugs are the opioid antagonists. Under this, we have naloxone and naltrexone. Now, amongst the two, naloxone na ang meron tayo sa Pilipinas. Naltrexone, wala. Okay? Now, naloxone has a very short duration of action of 1 to 2 hours. And oftentimes, ang naloxone ang ginagamit natin as an antidote for morphine toxicity. Acute morphine toxicity. Okay? So, kapag halimbawa, nag-decide akong lumaklak ng isang bote ng morphine at na-hospital ako, unang bibigay sa akin is naloxone. Dahil wala namang naltrexone dito sa Philippines. Now, what is the main difference ba between naloxone and naltrexone? Naloxone, yun na nga, a short duration siya, so you will require multiple dosing to achieve desirable effects. Okay? So, normally, kapag binigyan ka ng naloxone, parang every 5 or 15 minutes, binibigyan ka ng isang ampule. Unlike that of naltrexone. Naltrexone has a half-life of 48 hours. Oh, sorry, it lasts for 48 hours. So, kahit isang dose lang sanang naltrexone, okay ka na. Yun na nga, sadly, it's not available in the Philippines. Okay? Okay. Now, lastly, okay, hindi sila makategorize, so let's just call them others. Okay, we have the drugs, tramadol, tapentadol. Okay, I guess mas familiar tayo sa tramadol. Okay, we have loperamide, diphenoxylate. You're familiar with loperamide, I believe. And then, dextromethorphan. So, all of these drugs are still under the category opioids. So, meaning, if misused, these drugs can still cause addiction. Okay? Class, kapag kayo naging pharmacist na balang araw at magtatrabaho sa community pharmacy, you might encounter patients who will buy boxes of tramadol o di kaya bote-bote ng dextromethorphan. Okay, most likely kapag ganoon ang patients mo, huwag yung pagbentahan kasi yun yung mga patients na addicted na sa tramadol or dextromethorphan. Right? Okay, so in addition to weak mu receptor agonist activity of these drugs, okay, tramadol weakly blocks the reuptake of serotonin and norepinephrine, and it's also a MAO inhibitor. Whereas tapentadol blocks norepinephrine reuptake only. Okay, so between the two, mas delikado gamitin ang tramadol kasi it can cause hypertension crisis if combined with thiamine-rich foods or kapag sinamahan mo ng norepinephrine or anything that can increase catecholamines. So, we good? Okay. Now, between the two, tramadol and tapentadol, okay, actually sa Philippines, ang tramadol lang naman ang meron tayo dito eh. So, tramadol is designed for neuropathic pain. So, meaning pain associated with the nerves. While tapentadol naman, okay, can be used for moderate pain. Halos kahit ano namang pain pwedeng i-treat ng tapentadol. Pero then again, let me repeat, in the Philippines, we only have tramadol. Now, please take note of this class, ha? Tramadol and tapentadol are associated with increased risk of seizures. So, therefore, they are greatly contraindicated for patients with epilepsy. So, once a patient has a history of seizure or may epilepsy siya, wag na wag nyong bibigyan ng tramadol or tapentadol. Kasi baka biglang mag-seizure yung patient na yon. So, are we clear? Hindi ko sinasabing mag-seizure talaga siya, pero there is a very good chance na mag-seizure yung patient. Okay? Okay. So, what are the clinical uses of opioids? So, it is mainly used as an analgesic. So, morphine is used for severe pre-operative or post-operative pain. Ginagamit din siya for patients with terminal cancer, okay, terminal illness. And it can be used for visceral pain. So, other than its analgesic pain, okay, morphine can also decrease anxiety, cause sedation, okay. It can also cause euphoria, right? Loss of memory, recent memory. Okay, so these things can actually be useful properties of morphine kasi iniiwasan nila yung frightening pain disorders. Okay, or it prevents you from experiencing the nasty effects of pain. Okay, so halimbawa, meron kang MI. So pag binigyan ka ng morphine, at least, bago ka mamatay, masaya ka. Hindi kaya pag may cancer ka. Okay, you know Cory Aquino? Right? She had stage 4 colon cancer. So, nung malapit na siyang mamatay, binigyan na lang siya ng morphine to ease her passing. Okay? Okay. So, other uses of opioids, we have diarrhea. Okay? So, most opioids have very strong anti-diarrheal property. Now, codeine, diphenoxylate, loperamide are widely used for this condition. Now, bakit ba merong anti-diarrheal effects ang opioids? Now, this is attributed to their anticholinergic effects. Okay, if you remember guys, di ba, ang anticholinergics decreases GI motility. So, therefore, causes constipation. Okay? Now, FYI lang din guys, what's the max dose of loperamide? Loperamide can only be used, you can only use 8 milligrams of loperamide in a span of 24 hours. So, anong loading dose ng loperamide? Okay, if you've used this before, okay, you can start with 2 capsules as loading dose, tapos 1 capsule for every loose bowel movement. Pero please take note, you are only limited to 4 capsules in 24 hours. Okay, so loading dose mo, ubos na agad yung kalahati, so you can only use 2 additional capsules within 24 hours. Now, of course, codeine, diphenoxylate, and loperamide have lesser abuse liabilities as compared to morphine. Okay? Now, another use of opioids would be for acute pulmonary edema. So, morphine relieves dyspnea associated with pulmonary edema secondary to left ventricular failure. Now, guys, you can search about this in the internet. Pero I'm telling you guys, we will be discussing this sa pharmacology too. Okay? Now, what is dyspnea? Dyspnea is difficulty in breathing. So, parang nagagasp ka ng air. Okay? So, that's like, okay, yung feeling na ganun, that's dyspnea. Right? So, morphine can suppress the respiratory centers of the brain, causing a decrease in oxygen demand. So, think about this. Sabi natin, morphine can cause respiratory depression. So, bakit siya ginagamit for dyspnea? Okay? Now, isipin niyo to guys pag may dyspnea ka, okay, you're gasping for air. Kasi mataas ang oxygen demand mo. Okay, now sige, fine. Let me explain first what is oxygen demand. Okay? Now, normally class, halimbawa, nag-e-effort ka. Okay? O sige, example, pagmamahal. Okay? Nag-effort kang magmahal ng isang tao. So obviously, dahil nag-e-effort ka, you will be demanding from that person. Tama ba? Sa taong pinag-effortan mo. Ngayon, pag hindi na-meet ang demand na yon, halimbawa, dinedma ka. Okay? Nag-effort ka, binigyan mo siya ng cake, nagbigay ka ng oras para sa kanya, pero hindi na-appreciate. Okay, di ba you will feel upset, you will be disappointed. Same thing din naman sa katawan natin. So halimbawa, ang puso mo nagko-contract. Okay, contract siya ng bongga. So obviously, kapag mabilis ang contraction ng puso, nag-effort siya mag-pump ng blood. So habang nagpa-pump siya ng blood, okay, it will be demanding for more oxygen para makapag-pump pa siya ng mas maayos. Now, kapag hindi mo ma-meet yung oxygen demand na yon, ano nangyayari sa puso mo? Pwede siyang ma-damage or masasaktan siya. Okay, that's why it appears in the form of chest pain in the case of angina or heart attack. Now, in the case naman of dyspnea, okay, sa dyspnea, kinukulangan ka na sa oxygen. So, ano ginagawa ng morphine? Morphine, binabawasan niya ang pagiging demanding ng katawan mo. Demanding for oxygen. So, dahil kapag may dyspnea ka, okay, you can't take in a lot of oxygen. You're gasping for air. Kaya ang tendency is tumataas yung oxygen demand mo. With the use of morphine, it can decrease oxygen demand. So, nagets ba yon? Or medyo naguluhan tayo? Okay? So anyway, kung sakaling mang naguluhan kayo sa part na to, right, just ask me, okay, or I'll explain this sa class natin. Alright? Mahirap gumawa ng movements dito na wala naman lumalabas sa slides ko. Okay, hindi nyo naman nakikita yung movements ko. Okay? Pero again, let me just repeat. Morphine is used to relieve dyspnea associated with pulmonary edema. Pag sinabi natin pulmonary edema, may tubig ka sa baga. Okay? And left ventricular failure often happens kapag meron kang congestive heart failure. Now, you will learn more about this class when you reach pharmacology 2 kasi pharmacology 2 is more on cardiovascular system. Alright? Okay. Now, another use of morphine would be for myocardial infarction because morphine can cause vasodilation and, again, decrease oxygen demand sa puso, making it useful for MI. Okay, so again, ulitin ko lang okay, kapag pinabawasan niya oxygen demand, okay, mas hindi nasasaktan yung puso. Alright? Kasi kapag nagiging demanding ang puso, lalo na siya nasasaktan pag hindi na-meet yung demand. So at least, pag nagbaba ng expectations yung heart, halimbawa, binigyan ka ng morphine, so babagal yung tibok niya, lesser ang demand niya for oxygen. So kapag lesser ang demand for oxygen, lesser ang pain na nararamdaman niya. So making it very useful for heart attacks or MI. Okay? Now, pentazocine and butorphanol, again, it should not be used for patients with MI because it can increase preload. When you increase preload, it increases oxygen demand. Now, ano lang pwede natin gamitin sa group ng mixed agonist-antagonist? You can only use nalbuphine. Okay, so you can't use pentazocine or butorphanol. Okay? Now, I think this one is hindi pa naman. Okay, so next use of morphine would be for coughing. Okay, so opioids directly depress cough centers of the medulla. And the most popular drug for this would be codeine. Okay, so it is mainly used for severe cough. Now, for moderate or mild cough, we can use dextromethorphan, which is also derived from codeine. Now, let me just repeat dextromethorphan is also derived from opioids. Kaya pwede rin mag-inaddict ang isang tao sa dextromethorphan or yung robitussin. Okay, so dextromethorphan is used for coughing. So yun na nga, used for mild to moderate coughing. Okay, it has less addicting property at therapeutic doses, but at overdose, it can become highly addicting. Okay, Now, as for the anesthetic application of opioids, okay, morphine and fentanyl ang kadalasang ginagamit dito. So, morphine, it is used for its analgesic, sedative, and anxiolytic effects, while fentanyl is much preferred because of its shorter duration of action. Now, most of the time, ginagamit ang drugs na to as regional anesthesia. Now, kapag sinabi mo class regional anesthesia, only a certain part of your body is anesthetized. So, usually we do this via epidural or intrathecal. So, ina-administer ang morphine or fentanyl via the spine. So, pwede sa epidural space or intrathecally. Okay? Now, again, let me repeat ha. Pag regional anesthesia, only a certain part of your body is anesthetized. Halimbawa, sinisias, cesarean section. Okay? Pag sinisias ka, kadalasan, gising ang nanay. Kasi regional anesthesia lang ang ginagamit. Pero depende sa nanay. Pwede rin naman siya mag-opt for general anesthesia, tulog siya. Okay? Pero most of the time, preferred ng mga doctors na kapag cesarean section ka, regional anesthesia lang para gising ang nanay. Okay? Para paglabas ni baby, kita agad niya si nanay. Okay? Or kita agad ni nanay si baby paglabas. Okay? Now, high-dose fentanyl and its conjugates, okay, or morphine, are used as primary anesthetics in cardiovascular surgery, okay, for the main reason na it has minimal cardiac depression. Now, by giving morphine and fentanyl via the spine, it can actually reduce the onset of ADR. Pero again, it can still cause respiratory depression, pero na-delay yung respiratory depression part. Okay? So, are we good? So, let me repeat. By giving morphine and fentanyl into the spine, okay, nababawasan yung kanyang adverse drug reaction. Okay? So, again, morphine and fentanyl is mainly used for cardiovascular surgery. Right? Now, kung sakali man nag-inadik ka sa morphine, right, you can give methadone or buprenorphine. So, these are drugs used to mitigate withdrawal from opioid abuse. Right? Now, in summary, we have this table. So, I won't be reading this out loud. You can just read it as you are studying for the quiz or the exam. Okay? Now, for the adverse drug reaction associated with morphine, so we have the following ADRs. Okay, so the respiratory depression part is attributed to the activation of the mu receptors. Okay, so obviously, you cannot use morphine for people with emphysema or COPD kasi ito yung mga taong kulang na kulang sa oxygen. Okay? Pero kung sakaling dyspnea associated with pulmonary edema, pwede mong gamitin ang morphine. Okay? Pero you cannot use morphine for emphysema or COPD. Right? Now, another condition na hindi mo pwedeng gamitan ng morphine or any opioid is head injury. Okay? Kapag ang isang tao nabagok halimbawa ang ulo, hindi mo pwedeng bigyan ng morphine because morphine can increase intracranial pressure in the brain, right? Because when you start giving morphine, it causes cerebral vasodilation, which further increases intracranial pressure. Okay? Other than that, morphine can also cause pneumonia. Now, why does it cause pneumonia? Pneumonia is a potential result of a reduced cough reflex when opioids are used for analgesia. So, if you remember, class, opioids in general suppresses the coughing reflex. Now, kapag hindi mo kasi nailabas or hindi gumana ang cough reflex mo, naiiwan ang bacteria sa my lungs, which could cause pneumonia. So, are we clear on that? Okay. Now, another side effect associated with opioids, pinaka-common niya would be constipation, urinary retention, and meiosis. Now, this is because of its anticholinergic effects. So, let me repeat. Opioids in general have anticholinergic effects. Now, yung sa meiosis part naman, okay, the pinpoint pupil is often the sign of morphine overdose. So, kahit madilim na ang kwarto, sobrang liit ng pupil ng isang taong na-overdose sa morphine. And that's attributed to its anticholinergic effects. Okay? Now, another side effect associated with opioid is yung postural hypotension brought about by vasodilation. Okay, opioids in general can cause vasodilation. At kapag nag-vasodilate, this one causes a reduction in blood pressure leading to hypotension. Now, opioids can also inhibit baroreceptors. Now, baroreceptors class are the receptors that monitors for changes in the blood pressure. Okay? So, normally, kapag na-inhibit ang baroreceptors, pag bumagsak ang BP mo, tuloy-tuloy yung pagbagsak. Kasi pag gumagana ang baroreceptors, pag bumabagsak ang BP, kinokontra yung pagbagsak by causing tachycardia. Now, in the case of using morphine or any opioids, na-inhibit yung baroreceptors, kaya pag bumaba ang BP mo, tutuloy-tuloy yun. Okay? And other than that, morphine or opioids can also can also increase histamine release. Alright? Okie dokie. So, what else? Opioids can also cause nausea and vomiting. Now, this is a common side effect of opioids. Parang almost 50 or 60% of people using opioids will experience nausea and vomiting. Why? Because opioids can bind to or stimulate the CTZ. Now, if you remember the CTZ, that is the vomit center of the brain. Okay? And then lastly, morphine can cause addiction or tolerance. Okay? This is because morphine can cause euphoria, and tolerance can occur due to continued use of opioids. Now, normally the tolerance happens with 2 to 3 weeks of using opioids. Now, when a patient is tolerant to morphine, you will require higher dose to create analgesia. Now, yun nga lang, kapag tinaasan mo naman ang dose, there is a higher tendency for the patient to become addicted or dependent to the opioid. And then lastly, morphine, you should avoid morphine for pregnant women for obvious reason. But other than that class, hindi nakakatuwa. Okay, nakakalungkot na there are some mothers who become addicted with heroin or morphine. Tapos, hindi nila alam, buntis pala sila. Now, kapag naging addicted ang isang nanay sa morphine, naipapasa niya ang morphine sa baby. So, ibig sabihin, bago pa pinanganak si baby, addict na siya sa morphine. So, pregnant mothers taking opioids during pregnancy will give birth to children who are addicted to the drug. Now, if the child does not, pinanganak siya, nabuhay, okay, if the child does not take a dose of morphine, okay, they go into withdrawal and these children or babies may die. Okay? So, nakakamatay kasi ang withdrawal effects ng morphine. So, nakakalungkot isipin na baby pa lang sila, kakapanganak pa lang, addict na sila sa morphine. Now, kaya lang naman sila naging addict, it's because of their mother. Okay? So, yun. So, that's a sad fact that some mothers, okay, kapag na-addict sila sa morphine, napapasa nila yung addiction na yun sa babies nila. Okay, so in summary, guys, we have this table. So these are the substantial side effects associated with opioids and the minimal side effects associated with opioids. Okay? Okay. All right, so let's talk about naman this time about inflammation. So we're done with pain. Okay. Now, inflammation naman is caused by harmful stimuli such as pathogens. Now, pathogens can come in the form of microorganisms, could be bacteria, viruses, etc., etc. Damage cells. Okay, so if you remember, pag na-damage ang cells, it produces prostaglandin. So we'll discuss this more in details in a while. Okay, or irritants. Now, it is a protective response involving immune cells such as the white blood cells, blood vessels, which causes vasodilations, and molecular mediators. Now, what is the main function of inflammation? Okay, inflammation, its main function is to eliminate the initial cause of injury, clear out necrotic cells and tissue damage from the original insult and the inflammation processes. Okay, and to initiate tissue repair. That's probably the most important job of inflammation, to facilitate tissue repair. Okay, now, balikan natin yung example natin kanina. Yung daliri na natuhog ng pako. Okay? So, assuming natuhog nga ng pako yung inyong daliri, so ano ba nangyayari sa loob niyan? Okay? Now, sabi nga natin, in the environment, we have a lot of pathogens and bacteria which could easily enter our broken skin. Now, assuming pumasok na yung bacteria na yun sa loob ng skin natin. Okay? Now, in response to the presence of pathogen inside the body, we produce, or our white blood cells respond to that. So, ano ba usually ginagawa ng white blood cells? White blood cells can destroy pathogens. Yun nga lang, sometimes, ang pathogens natin, mas mabilis mag-produce kesa sa makakayang patayin ng white blood cells natin. So, what does the white blood cells do? So, the white blood cells, dahil siya ay overwhelmed na, okay, starts producing the compound histamine. Now, please take note lang, histamine can bind to nociceptors which can cause the feeling of pain para ma-alert ka na there is something wrong. So, kumbaga, unang initial na gagawin ng white blood cells is nakakita siya ng pathogen, sabihin niya na agad sa katawan mo, uy, may something wrong. Okay, so it produces histamine. Now, other than binding to nociceptors, what else does histamine do? Histamine can also bind to nearby blood vessels or capillaries. Now, anong ginagawa ng histamine? Once histamine starts to bind to blood vessels or capillaries, it causes vasodilation. Na kapag nag-vasodilate na ang ating blood vessels, mas luluwang siya, so mas mabilis ngayon mag-rush ang blood. Now, kapag nag-rush ang blood natin to the site of the inflammation, this causes redness and heat. Okay, example of which class ng vasodilation would be, halimbawa, kapag ikaw ay nahihiya, di ba, namumula ka, namumula yung mukha mo, tapos pakiramdam mo ang init ng mukha mo. Now, that is because the blood vessels in your face starts to dilate. Kapag nag-dilate siya, mas mabilis aakyat ang dugo. So, therefore, mainit siya sa pakiramdam. Okay? Kasi ang dugo natin is mainit. And at the same time, namumula ka. Kasi ano ba ang kulay ng dugo natin? Pula. So, same thing, class, happens sa site kung saan nagkaroon tayo ng inflammation. It causes redness and warm feeling because the blood vessels or the capillaries in that site started to dilate. Okay? Now, if you also notice, class, ano ang nangyari sa walls ng blood vessels natin? If you notice, kanina makapal siya, ngayon, numipis na. Now, may significance yung pagnipis na yan ng blood vessels natin. Kasi na-stretch out na siya, nag-dilate. So, di ba, pag nauunat, numinipis. Okay? Now, within the blood vessels, may tumatakbong mga white blood cells dyan. So, anong gagawin nung white blood cell na na-expose sa bacteria? Siyempre, dahil hindi niya kayang patayin lahat ng bacteria na to, tatawag siya ng resback. Okay? Through the use of chemotactic mediators. So, it will start calling for other white blood cells. Okay? Now, dahil nag-release siya ng chemotactic mediator, yung mga white blood cells na to, maa-attract sa nag-produce ng chemotactic mediator na yon. So, dahil nga tinawag sila ng white blood cells na nakakita sa bacteria, so, anong gagawin nila? Lalabas sila papunta sa mga bacteria na yon. Now, isipin nyo, class, paano na lang kung hindi manipis yung blood vessel wall natin? Hindi makakalabas dyan ang white blood cells. Kaya, napaka-importante nung histamine na yon, na pinroduce nung white blood cell na na-expose sa bacteria because it caused vasodilation. And when vasodilation happens, ninipis ang wall, mas mabilis makakalusot dun yung mga white blood cells. Now, what happens now? Dahil marami na ang white blood cells, kayang-kaya nilang i-destroy lahat ng pathogens na yan. Now, yun nga lang, class, because numipis ang blood vessel wall, okay, pwedeng mag-seep out yung plasma sa loob ng blood vessel. Okay? Now, the seepage, okay, will cause edema. So, from the intracellular environment, okay, which is inside the blood vessel, from the blood vessel, pwedeng lumabas ang fluids nun papunta sa extracellular environment, which now causes edema. That's the reason why, minsan, di ba, pag nasugatan ka, mapapansin mo parang umuumbok yung sugat. Umumbok yun kasi yung plasma, surrounding air na yun, lumabas na papunta sa extracellular spaces. So, are we clear? Okay. So, here's a summary, class, of what happens during the inflammation process. So, I leave this for you to study. Okay, and then, here are the cardinal signs of inflammation. So, heat, kasi nga, nag-rush yung blood, nag-vasodilate, so nag-rush ang blood, ramdam mo yung blood, so it produces heat. Now, other than that, may other reasons pa kung bakit nagpo-produce tayo ng heat. I'll discuss this as we go on. Okay, so there's also redness because of the vasodilation, swelling kasi nagkaroon ng edema, pain, obviously, because of histamine binding to nociceptors, and loss of function. Now, because nagkaroon ng inflammation, hindi mo maigagalaw yung certain area ng body na yun or kung saan yung nagkaroon ng inflammation. At the same time, may pain. Kaya hindi na siya maigalaw. So, there's loss of function. Okay? Now, let's go into a more detailed discussion of how inflammation works. Now, let's go down to a more cellular level. So, assuming we have here a cell that is injured. Okay, so what happens now? Okay, so let's do i-magnify natin yon. Right? Di ba sabi natin, kapag na-damage ang isang cell, nadadamage yung kanyang cell membrane. So, ano ba yung component ng cell membrane natin? Phospholipids. So, madidisrupt yung phospholipids sa loob ng cell membrane natin. Now, when phospholipids are exposed, okay, phospholipase A2 acts on this exposed phospholipids. Now again, paano lang ulit ma-expose ang phospholipids? Kapag na-damage ang cell membrane. Okay, now when phospholipase A2 acts on the phospholipids, it creates arachidonic acid. Arachidonic acid, siya ang simula ng kalbaryo natin. Right? Now, if arachidonic acid is acted upon by lipoxygenase, it creates leukotrienes. Now, leukotrienes is highly involved in asthma. Why? Because leukotrienes are potent bronchoconstrictor which induces asthmatic attacks. Okay, pero again, for now, class, hindi naman asthma ang topic natin. And our topic is more on pain and inflammation. Alright? Now, arachidonic acid can be acted upon by another enzyme, okay, which is either COX-1 or COX-2. Now, collectively, COX-1 and COX-2 are known as prostaglandin H2 synthase. Now, COX-1, this is activated by physiologic response. So, this is the more natural or yun yung constitutive or laging nandyan lang yan ang COX-1. Now, ang COX-2 naman, lumalabas lang kapag nasasaktan ka. Okay? So, it responds to inflammatory stimulus. Now, either one of these enzymes can act on arachidonic acid, which in turn will produce prostaglandin H2. Okay? Now, prostaglandin H2, kumbaga ito yung pinaka-parent compound, it can be acted upon by so many enzymes. So, example of which would be prostaglandin D2, which is produced by prostaglandin synthase. Okay? Now, prostaglandin D2 can cause vasodilation, okay, and inflammation in response to allergy. Now, kapag may asthma ka, ang pinaka-culprit dyan, most of the time, is the prostaglandin D2. Okay? Now, another enzyme that can act on prostaglandin H2 is prostaglandin E synthase 1, which produces prostaglandin E2. Okay? Now, ang prostaglandin E2 na to can have so many effects. One of which would be also vasodilation. Now, if you remember class, sa inflammation, importante ang vasodilation. Tama ba? Because vasodilation causes the redness, the heat, and it also causes the edema. Now, other than that, prostaglandin E2 can cause bronchoconstriction. So, again, involved din siya sa asthma. Okay, it can also cause GI muscle contraction. Now, when I say GI muscle contraction, it stimulates the intestine. So, it causes peristaltic movement. So, meaning, ano pwedeng gawin ng PGE2 ko? Can it cause constipation or diarrhea? Alright, you guess it right. Okay, it's diarrhea. Okay, other than that class, prostaglandin E2 can also decrease acid production and increase GI mucus. Now, when you say increase in GI mucus, okay, ang ating stomach kasi is protected by the GI mucus. So, meaning, kapag marami akong prostaglandin E2, well-protected ang GI tract ko or aking stomach. So, prostaglandin E2 plays a vital role in protecting the stomach. So, you actually need PGE2. Okay? Yun nga lang, kapag activated din ang PGE2, it causes pain. It causes pain. Okay? And PGE2 also plays a vital role in uterine contraction. Kaya mga girls, kailan ba tumataas ang PGE2 ninyo? Kapag meron kayong dysmenorrhea. Right? Have you noticed, girls, kapag may dysmenorrhea ka, di ba parang nagko-contract yung puson mo, so masakit, so there's pain associated with PGE2. And at the same time, minsan kapag dysmenorrhea ka, you get diarrhea. Tama ba? Okay, nagda-diarrhea ka. Now, that diarrhea is because of prostaglandin E2, which is the cause of your dysmenorrhea. Alright? Are we good? Okay. Now, hindi lang yung class. Ang prostaglandin E2 can also cause pyresis. When you say pyresis, it's fever. Okay? So, yung heat na nararamdaman natin during inflammatory process is not only attributed to vasodilation, wherein it causes the rushing of the blood. So, yung blood mainit. Okay? PGA2 also causes heat. Okay? So, it causes pyresis, which causes now fever. Now, lastly, the effect of PGE2 would be increase in renal blood flow. No, kapag mabilis kasi ang renal blood flow natin, okay, it provides renal protection. So meaning class, PGE2 is important for protecting the stomach. It is also important for protecting the kidneys. So hindi naman talaga all bad ang PGE2. Alright? Okie dokie. So what else? Okay. Now another compound that is produced from prostaglandin H2 is prostaglandin F2 alpha. Okay, now prostaglandin F2 alpha causes uterine contractions then, bronchoconstriction, and it also decreases intraocular pressure. So this one plays a vital role in preventing glaucoma. Okay, so are we good with that, class? Okay. The next one, when thromboxane synthase acts on prostaglandin H2, we produce thromboxane. Now, thromboxane, okay, causes platelet aggregation. So, thromboxane causes clot formation. Now, the opposite kasi of thromboxane also comes from prostaglandin, prostaglandin H2, which is prostacyclin. Prostacyclin is PGI2. Now, notice, okay, si prostacyclin causes vasodilation, while thromboxane causes vasoconstriction. Okay? Si prostacyclin causes bronchodilation, while thromboxane causes bronchoconstriction. So if you notice, class, lahat ng effects ng prostacyclin opposite ng thromboxane. So are we clear? Okay. Okie dokie. So, what else do you need to know about here? So if you notice, class, almost all, oops. Oh my goodness. Okay, ulit. Okay. So sorry. Commercial break muna tayo. Okay, mali ang napindot ko. Haba na nun ah. Oh my gulay. Okie. So ayan, acted upon by COX-1, COX-2. Okay, which produces prostaglandin H2. Hirap din pala pag sa kino to. Pag namali ka ng pindot, ulit lahat sa umpisa. Hindi lang pa isa-isang animation. Okay, so commercial break muna tayo, guys. Okay, I think malapit na tayo. Okidoki, thromboxane. So, ayun. Okay, so we're back. Okay, so if you notice, guys, almost all products ng prostaglandin H2 causes vasodilation. With the exception of thromboxane, kasi siya lang yung nagkakos ng vasoconstriction. Okay, so that's the reason why, class, products of prostaglandin H2, okay, plays a vital role in inflammation. That's why if I can inhibit prostaglandin H2, I can actually prevent inflammatory responses as well. Okay? So are we good? So in normal conditions, class, if you notice, prostaglandin E2 protects mostly the vital organs such as intestines, which causes yung motility nga, okay, smooth muscles, the kidneys, the GI tract. Okay? Now, in normal conditions also, prostacyclin and thromboxane counteracts each other. Okay? In inflammation, there's saturation of the prostacyclin, so there is more vasodilation, okay, inhibition of platelet aggregation, etc., etc. Right? Now, steroids. Who among you are familiar with steroids? Okay, so I guess yung mga may asthma, okay, are familiar with the use of steroids. Now, class, steroids kasi is a drug that inhibits phospholipase A2. So, tinatarget niya ang punot dulo ng cause ng inflammation, which is arachidonic acid. So, without phospholipase A2, phospholipids cannot be converted into arachidonic acid. So, therefore, wala agad ang inflammation. So, that's the reason why, class, steroids are widely used for inflammatory disorders. Okay? Now, another set of drugs would be the leukotriene inhibitors such as montelukast. Okay, if you notice, montelukast naman ginagamit ito for asthma because it prevents leukotrienes, which is a potent bronchoconstrictor. And then our topic for today is the NSAIDs. Okay, so for most types of inflammation and acute pain, very useful ang NSAIDs because NSAIDs can inhibit COX-1 or COX-2, which produces now prostaglandin H2. Now, kung walang prostaglandin H2, wala rin sanang PGE2 and PGI2, which is the two main prostaglandin analog that causes pain. So, are we clear? Let me repeat, ha? The two prostaglandin analog that causes pain is the prostaglandin E2 and then the PGI2, or also known as prostacyclin. Now, as for steroids, there is a delay in the inhibition of pain. Kaya most of the time, corticosteroids are only given for patients with moderate to severe acute pain and inflammation. Kasi most of the time, mas maraming side effects associated sa steroids kaysa sa NSAIDs. So kung papipiliin kayo class between steroids and NSAIDs, initially, start ka muna with NSAIDs. Pero kung severe na ang pain at ang inflammation, malala na, like in asthma, nag-inflame lagi ang bronchioles mo, then saka ka gumamit ng steroids. Because there are so many unwanted ADRs sa steroids, like tataba ka. Okay, it causes increase in fat mass. Okay, it causes immunosuppression, it causes osteoporosis, etc., etc. Okay, so for today class, ang main topic natin is NSAIDs. So how do NSAIDs work? Okay, so to understand how NSAIDs work, let us first identify the roles of the enzymes they inhibit. So ano nga ba ulit yung enzymes na inhibit ng NSAIDs? Either COX-1 or COX-2. So when there is a physiologic stimulus, sino mag-respond? Very good. It's the COX-1. So COX-1 class is constitutive. Okay, when I say constitutive, it means COX-1 is always in the body. So, okay, kasi constant ang input ng physiologic stimulus, so lagi may COX-1 tayo. So kapag na-activate ang COX-1, okay, ang affected organs would be the stomach, intestine, kidneys, platelets, endothelium. Okay, now sa stomach, okay, kapag activated ang COX-1, it causes the formation of the mucus. So meaning, COX-1 actually protects the intestines and also protects the kidneys. Alright? Very good. Okay, so ang main products na involved here are thromboxane, prostacyclin, PGE2. Now, para saan ang thromboxane? For platelet aggregation, blood coagulation. Prostacyclin naman, okay, it's to destroy blood clots. Sorry, it's to prevent platelet aggregation. Okay? Now, before I forget, prostacyclin nga pala class is most often found in the endothelial cells. Endothelial cells found in the blood vessels. Kaya, have you ever noticed bakit hindi nagka-clot ang dugo natin habang nasa loob siya ng katawan? Pero pag lumabas, saka siya namumuo. Okay? It's because within the blood vessel itself, we have prostacyclin, which prevents the blood from coagulating. Isipin nyo lang, paano lang kung ang blood natin nag-coagulate sa loob? E hindi na mag-flow yung blood natin. Okay? Okay. So, this one results to mostly physiologic functionings. Now, what about kapag nagkaroon ng inflammatory stimulus such as nasuntok, okay, nasugatan, etc., etc. So, anong cyclooxygenase enzyme ang ma-activate? We have the COX-2. So, COX-2 is inducible. So, meaning, kailangan, you have to induce it. Okay? COX-1, lagi lang nandyan. COX-2, ini-induce pa para ma-produce siya. Okay? And what induces it is inflammatory stimulus. Okay? So this one causes activation of inflammatory sites like WBC or macrophage. Okay? And the main players here are the prostaglandin protease and oxygen molecules or peroxides. Okay? Which in turn causes inflammation. Right? Now, if I start using traditional NSAIDs block both COX-1 and COX-2. Okay sana kung binalak niya lang ang COX-2. At least nawala yung inflammation. Kapag binalak niya ang COX-1, ano pwede mangyari? It could lead now to GI upsets kasi wala na magpoprotect sa stomach natin. It can also cause bleeding problems because it will also inhibit thromboxane. And at the same time, it will also cause kidney damage. Kasi again, para sa ng COX-1, it protects the kidneys by increasing renal blood flow. So without prostaglandin, without COX-1, okay, bababa ang blood flow going to the kidneys, causing now kidney damage. Ibig sabihin, kukulangin sa oxygen ng kidneys. So kapag kinulangan ng oxygen ng kidneys, masisira siya. So are we clear? So that's why class, you never give NSAIDs for people who has kidney failure as much as possible. Okay? Now, what about for COX-2 inhibitors? COX-2 inhibitors were created class for the purpose of avoiding the GI upsets and the bleeding problems. Yun nga lang, even if it is a COX-2 specific inhibitor, it can still cause kidney damage and can have cardiovascular complications. Why? Because by inhibiting COX-2, it actually promotes thromboxane activity. Ano ulit ang ginagawa ng thromboxane class? it causes blood clot formation. At kapag nagkaroon ng blood clot, halimbawa sa puso mo, edi mababarahan ang puso mo ng blood clot na yon, causing MI. It's a cardiovascular event. Okay? Or what about kung ang blood clot umakyat sa brain? Okay? So therefore, mabablock yung artery sa brain, causing now stroke. And so on and so forth. So, are we good so far? So, kung napapagod kayo, just hit pause. Okay? Para ma-absorb nyo ng maayos ang inaaral ninyo. Right? So, if you're ready to start, then just hit play again. Okay? So, now, how do we classify NSAIDs? Now, ang classification ko dito is based on chemical classification. You can also classify NSAIDs based on their capacity to inhibit cyclooxygenase enzyme. Now, dalawa lang naman yan eh. Non-selective or COX-2 selective. Pag sinabi kong non-selective COX inhibitor, mula salicylates hanggang alkanones yun. Okay, and then, COX-2 selective inhibitors. Okay? So now, let's talk to the mother of all NSAIDs, the salicylates, specifically the aspirin. Okay? So, under salicylates, we have aspirin, mesalamine, sulfasalazine, and salicylic acid. Now, aspirin is the prototype drug for all salicylate. Now, aspirin is no longer used for its anti-inflammatory or analgesic effects. So, have you noticed, class? Pag may lagnat ka, gumagamit ka pa ba ng aspirin? Di ba? Most of the time, ginagamit natin is paracetamol, ibuprofen, other NSAIDs, but not aspirin. Okay? But, hanggang sa ngayon, aspirin is still considered to be the drug of choice for preventing the onset of first stroke. Okay? So, meaning, aspirin is mainly used for its antithrombotic effect, or meaning its capacity to block thromboxane. Are we good? Okay. Next one would be the mesalamine and sulfasalazine. So these two medications are mainly used for Crohn's disease. Now, what is Crohn's disease? You can search for this over the internet. Pero generally, class, Crohn's disease is an inflammatory disorder of the bowels. Okay, so pag may Crohn's disease ang isang patient, they can either use mesalamine or sulfasalazine. And then lastly, we have salicylic acid. Okay, I guess, who doesn't know salicylic acid, right? So it's used as a keratolytic. Right? Now, salicylates are mainly used for rheumatoid arthritis, osteoarthritis, or juvenile arthritis. Okay, now, normally we don't use aspirin anymore for its anti-inflammatory effects or analgesic effects. Pero kadalasan sa mga board exam questions or any exams, maraming lumalabas tungkol sa aspirin. So, let's talk about its adverse drug reactions. Okay? Now, most of the time, ang pinaka-main problem with using aspirin is its GI effects. It can cause GI upsets. So, about 70% of people using aspirin can have GI upsets. Right? Now, this is because of the inhibition of prostaglandin, specifically prostaglandin E2. Now, again, if you remember class, prostaglandin E2 is very important for protecting the stomach because prostaglandin E2 produces mucus that protects the stomach. Okay? It protects it from acid. Now, to prevent this, you can use non-acetylated aspirins, okay, non-acetylated forms such as, sodium, magnesium, choline salicylates, etc., or you can use enteric-coated aspirins, okay, so to prevent the GI side effects. Now, other than that, aspirin can also cause allergic reactions. That's why you should avoid using aspirin for patients with asthma, nasal polyps, recurrent rhinitis, also allergic reaction ito, or urticaria. Urticaria is hives, or di ba minsan kapag may allergy ka, nagpapantal-pantal ka? Okay, so kung may ganun kang klaseng allergies, don't use aspirin because aspirin can cause allergic reactions. Okay? So next one, aspirin should not be used for children with viral disease. Okay, now halimbawa may chickenpox, may beke, measles, never use aspirin. Why? Because aspirin can cause Rice syndrome. Okay, now Rice syndrome is an illness characterized by vomiting, hepatic disturbance, and encephalopathy. Okay, that has a 35% mortality rate. So meaning, if a child with a viral disease, halimbawa may chickenpox, nag-take siya ng aspirin, at nagkaroon siya ng Rice syndrome, okay, they only have about 65% chances of surviving that. Mataas-taas na naman, pero there's a 35% chance na mamatay din siya. Okay, so often than not, kapag may viral disease ka at may lagnat, don't use aspirin. Actually, we don't use aspirin for that purpose anymore. So, anong gagamitin mo pag may lagnat ka? Most often, it would be paracetamol. Right? So aspirin can also decrease GFR, so can cause kidney damage because it inhibits also prostaglandin E2. Okay? Now, aspirin can also prolong bleeding because of its activity on thromboxane. So you never use aspirin in combination with other anticoagulants because it can cause severe bleeding. So wag mong gagamitin in combination with clopidogrel. Actually, some people do that. Okay? Some doctors do that. Pero it's for the added benefit. Right? Pero you don't use aspirin together with warfarin, heparin, kasi talagang duduguin yung patient. Okay? So you don't use this for potent anticoagulants. Okay? Now, obviously, class, pwede ka rin mag-overdose ng aspirin causing toxicity. So, what are the signs of toxicity? Kung adult ito, adult ang nag-overdose ng aspirin, okay, that's called salicylism. Okay, now, ang often manifestation nito will include tinnitus. Tinnitus is the ringing of the ears. Yung parang, gumagano yung pangrinig mo. Okay, can also cause vertigo. Madalas nahihilo ka because, again, what controls the balance of the body? It's the ears. When you have salicylism, affected na organ dito is the ears. Okay, and then you get hearing loss. Now, for children, on the other hand, ang manifestation niya would be hyperventilation and acidosis. So, to prevent toxicity, what should we do? Okay, we can give the patient sodium bicarbonate kasi aspirin is acidic. Sodium bicarbonate is basic. Combine both, neutralization reaction. Okay? Now, other than that, you can do forced diuresis or gastric gavage. When you say gastric gavage, maglalagay ka ng tubo sa lalamunan ng patient, pobombahin mo ng saline water para subuka siya. Okay? So, are we good? Okay. So, other than that, aspirin can also cause postpartum hemorrhage. So, meaning, you never use aspirin for pregnant women. Why? Kasi pwedeng duguin ang patient, causing miscarriage. Kaya familiar ba kayo class sa Cortal? Okay? Dati, ang Cortal is made of aspirin. At ito ang madalas na ginagamit pampalaglag ng mga kabataan. Okay? Now, alam ng manufacturers ng Cortal yun, kaya anong ginawa nila? Pinalitan nila ng ibuprofen. So, kahit gaano karaming inumin mo ngayong Cortal, ibuprofen ang laman nun, hindi malalaglag si baby. Pwede siya magkaroon ng defects, pero hindi siya malalaglag. Okay? Kasi nga, yun na nga, aspirin can cause postpartum hemorrhaging. So, duduguin si nanay, malalaglag si baby. Okay? Now, the last side effect associated with aspirin is it can cause an increase in uric acid. So, would you recommend aspirin for someone with gout? No, because lalala ang kanyang gout. So, are we clear? Okie dokie. Okay, so the next group of drug would be para-aminophenol. Now, who doesn't know paracetamol, right? Okay, so paracetamol is basically used for its analgesic and antipyretic effect. Now, just please take note, class, paracetamol probably is the only NSAID with almost marginal or no anti-inflammatory effects. Meron man very negligible. Kaya nga, most of the time, paracetamol is just used for its analgesic and antipyretic effect. Now, plus the fact, class, na kapag meron kang lagnat, okay, paracetamol nga naman is the most ideal drug to be used for fever. Right? Now, ang main problem lang with paracetamol is that it causes hepatotoxicity. Bakit? Kasi kapag gumamit ka ng paracetamol, right, it's converted to the metabolite NAPQ. Okay, that's N-acetyl para-benzoquinone. Now, this product kasi can deplete the glutathione stores in the liver. So, this metabolite will therefore destroy the liver cells. Right? Now, the only way you can manage this is if you replenish the glutathione stores. Okay, now the antidote for hepatotoxicity associated with paracetamol is acetylcysteine, because acetylcysteine contains sulfhydryl groups that is similar to glutathione. So, are we good? Okay, so paracetamol is the ideal drug for fever and minimal to moderate pain, okay, and used for patients who cannot use or tolerate aspirin. Okie dokie. Now, next group of drugs will be the indolacetic acid. Now, this includes indomethacin, Sundilac, Tolmetin, and Ketorolac. Now, I guess ang pinaka popular drug amongst this group is the indomethacin. Now, indomethacin is a very potent anti-inflammatory drug. Okay, so it is good as an analgesic, but it's very well known for its anti-inflammatory property. It's also the drug of choice for ankylosing spondylitis. Na ankylosing spondylitis is a form of arthritis pero in the spine. Okay, so namamaga yung spaces sa spine mo. Right? Now, other than that, it's also used for Reiter's disease or Reiter's syndrome. Okay, Reiter's syndrome naman is a form of reactive arthritis that happens in the presence of bacterial infection in the body. So most of the time, halimbawa, meron kang bacterial infection, kapag may bacterial infection ka sa katawan, nagkakaroon ka ng rheuma. Okay? And that's known as Reiter's syndrome. Now, oftentimes, it affects the knees and your joints. Now, other than that, indomethacin can also speed the closure of patent ductus arteriosus. Okay, now, patent ductus arteriosus, this is a condition na common sa mga babies, wherein pinanganak sila, okay, may duct na nagko-connect sa kanilang pulmonary artery going to the aorta. Now, dapat kasi mawala yun, okay, because it can cause so many complications while the child is growing up. Now, you can use drugs like indomethacin to facilitate its closure, pero most of the time, doctors would prefer to go for surgery kasi maraming side effects associated with indomethacin, which we will go on as we proceed with the topic. Right? So, indomethacin is not recommended as a simple analgesic or antipyretic because of its potential for severe adverse effects. Now, what are these side effects or adverse effects? It includes bleeding and ulcerations. Bakit nga ba nagbi-bleeding? Because it inhibits thromboxane. Now, why ulcerations or gastric ulceration? Because it inhibits prostaglandin E2, which is responsible for protecting the stomach. Okay? Now, Sundilak, so this is the type of NSAID that commonly causes naman GI upsets and can be given topically. Now, tolmetin, it has lesser chance of bleeding, but it has a higher incidence of anaphylaxis. So, marami nagkakaroon ng severe allergic reaction with tolmetin. So, we rarely use this nowadays. Ketorolac, familiar ba kayo? Okay, now ketorolac can only be given via intravenous, so wala siyang oral dosage form. Okay, it's a potent analgesic, minimal anti-inflam. Meron siya pero hindi ganun kaganda. Okay? But its analgesic property is very good. Kaya most of the time it's used for surgical procedures. Right? Or halimbawa may bali ka sa buto, preferred drug nila dyan would be ketorolac. So, IV infusion of ketorolac. Now, just please take note, just limit its use to 72 hours because beyond 72 hours, pwede nang magkaroon ng GI upsets or renal damage ang patient. Okay? Pero, you can use it for more than 72 hours. Pero, ideally, don't. Okay? Okie dokie. So, next group of drugs are the propionic acid. Okay? I guess ang pinaka-popular dito would be the ibuprofen and naproxen. Okay? Then, we have phenoprofen and ketoprofen. Now, ibuprofen is the second-line drug for fever. First line natin is paracetamol. And long-term use of ibuprofen, especially in women, have been found to increase the incidence of hypertension among them. Okay? Now, bakit daw? Wag na muna ngayon, maubusan tayo ng oras. Okay? Pero, explain ko to class when we go to pharmacology too, when we reach the topic hypertension. Pero just take note, using ibuprofen constantly, parang kine-candy na siya, lalo sa mga babae, can cause hypertension. So, are we good? Okay. Now, naproxen naman is a potent OTC analgesic. So, kung halimbawa, you are in pain, at kaya mo naman ma-afford ang naproxen is actually a very good drug. Okay? It's actually the drug of choice for, I won't say drug of choice. Okay? It's the best drug for pain. Yun nga lang, mahal ang naproxen. Parang 20 pesos yata isang tablet niya or 26 pesos, I'm not sure. Okay? Compare that to ibuprofen or paracetamol, magkano lang yun? May generic ka pa. Okay? So, for paracetamol, parang piso lang ata ang generic nun. Now, for naproxen, most of the time, its dosing is once daily because of its long half-life. Now, phenoprofen have been reported to cause nephrotic syndrome. Okay, so it can cause kidney damage. Actually, lahat naman ng gamot na under NSAIDs can cause kidney damage. Right? Yun nga lang, maraming reports ang nakukuha from phenoprofen. And then, ketoprofen, okay, together with ibuprofen, has no interaction when given with other anticoagulants. So, if you are, say for example, taking warfarin or heparin, or you're taking any anticoagulant, it's safe to use ibuprofen or ketoprofen. Okay? ketorpophen. Ketorpophen. So are we good? Okie dokie. Next group of drugs are the enolic acids. Now, under this, we have piroxicam and phenylbutazone. Now, piroxicam, okay, it's an oxycam derivative, has a half-life of 45 hours, so it's long-lasting. Okay, yun nga lang, when you start using piroxicam, it has a high incidence of bleeding and gastric ulceration. Now, for phenylbutazone naman, it can cause bone marrow suppression. That's why we rarely use it. Okay, actually, nakarinig na ba kayong tawag gumamit ng phenylbutazone? So, parang wala pa akong narinig sa Pilipinas. Okay, probably in other countries, they use this. Pero they rarely use this because it can cause bone marrow suppression. So, it can cause agranulocytosis, drop in white blood cell count, etc., etc. Now, most of the time, ang phenylbutazone, ginagamit na lang sa kabayo. Okay? Okay. Next group of drugs are the phenamates. Now, I guess everybody knows this, right? Mefenamic acid. Now, girls, kailan nyo madalas ginagamit ang mefenamic acid? Kapag may dysmenorrhea. Pero study shows na kapag gumamit ka ng mefenamic acid, when you're having your period, it actually prolongs your period. Mas lalong tumatagal yung period mo. Kasi nga, mefenamic acid can also stop the activities of thromboxane, which causes increase in bleeding. Okay? Kaya sabi nila, kapag may dysmenorrhea, tiisin mo na lang. Okay? Kumuha ka ng hot compress, lagay mo na lang. Or di kaya paracetamol ka together with N-hyoscine. Okay? Buscopan. So anyway, mefenamic acid has similar effects to other NSAIDs. Yun nga lang, there's a high chance of GI disturbance. Kaya, paano iti-take ang mefenamic acid? Should always be taken after meals. Never take it before meals because it will cause GI upsets. Okay? Okay. Next drug is alkanones. Now, for the alkanones naman, isa lang ang gamot under that. We have nabumetone. Okay, nabumetone has similar effects when compared to other NSAIDs. Okay, now it's a non-selective COX inhibitor, but okay, it has more COX-2 inhibiting property as compared to COX-1. Now, because of that, dahil more on COX-2 siya rather than COX-1, it has less GI and bleeding adverse drug reaction. Okay, but then again, in the Philippines, we don't really have this drug, I think. Okay? And then lastly, we have COX-2 inhibitors. So I guess ang pinaka-popular sa inyo lahat would be celecoxib, right? Or etoricoxib, or coxa. Okay? Now, under this the rationale behind the development of these drugs was that inhibition of the COX-2 would reduce the inflammatory response and pain, but not inhibit the cytoprotective action of prostaglandins in the stomach, okay, which is largely mediated by COX-1. Okay? Now, hindi ko na sinama sa listahan dito is rofecoxib and valdecoxib. Kasi winidraw na yan from the market. Why? Because these two drugs, okay, have been associated with higher risk of MI, myocardial infarction, and stroke. No, actually, common ang stroke and myocardial infarction and stroke sa mga COX-2 inhibitors. Pero silang dalawang drug ang pinaka-prominent. Okay? Okay, so diclofenac, familiar ba kayo dito? I think ang brand name is Voltaren. Okay, now this is the most popular drug used in the UK. Similar effects to celecoxib. Meloxicam, okay, kapatid niya si piroxicam. Okay, so it has a 10-fold COX-2 selectivity. Okay, so it inhibits COX-2 more than COX-1, and it's 10 times more, kaya kinalasify siya under COX-2 inhibitor na kasi very potent yung kanyang COX-2 blocking capacity. Alright, now its adverse drug reaction is quite similar to piroxicam. Okay, etodolac naman, okay, it's mostly used for post-op, after operation. Now, celecoxib is the most popular preferred drug for osteoarthritis or rheumatoid arthritis. Now, celecoxib can also be used for pain, including bone pain, dental pain, halimbawa masakit ang ngipin, pwede ka mag-celecoxib, headaches, and ankylosing spondylitis, or yung rheumatoid, tawag ito, rheuma sa ating spinal cord. Okay? Now, etoricoxib, or yung arcoxia naman natin, okay, has been banned in the US, pero still in production in the Philippines, because in the US daw, it causes angina and MI. Okay? Now, in the case of the Philippines, wala masyadong na-report about that. Alright? Okie dokie. Now, just take note, COX-2 inhibitors in general have a higher risk for MI, stroke, thrombosis, accelerated atherogenesis, hypertension, and rash. Because COX-2 inhibitors can promote coagulation. Kasi nga, they do not inhibit thromboxane, unlike aspirin or other non-selective NSAIDs. They can block aspirin. Kaya nga, isa sa mga side effects nila, they can block thromboxane. Kaya nga, ang mga side effects ng drugs like aspirin is bleeding. Pero in the case of COX-2, they don't block thromboxane. So, ang nangyayari is, dahil binalak lang nila si COX-2, mas na-activate si COX-1, which causes the activation din of thromboxane. Now, kapag na-activate si thromboxane, there you go. You get blood clots. Okay? So, what are the clinical uses of NSAIDs natin? So, it's mainly used for inflammation. Okay, so NSAIDs are the first-line drugs used for rheumatic and non-rheumatic diseases. So, under rheumatic disease, you have rheumatoid arthritis, juvenile arthritis, osteoarthritis. So, sorry, before I forget. Anong pinagkaiba ng rheumatoid sa osteo? Rheumatoid arthritis is an autoimmune disease. So, sinong kalaban ko dito? Immune system, which destroys the joints. Osteoarthritis naman is known as the wear and tear. Sa pagtanda natin, nasisira yung joints natin because of wear and tear. And that is known as osteoarthritis. Juvenile arthritis, nangyari to nung kabataan mo. Okay, so it's early onset type of arthritis. So, minsan 4 years old, may arthritis na. Okay, psoriatic arthritis, ankylosing spondylitis, Reiter syndrome, all of these are rheumatic diseases. Now, for non-rheumatic diseases, you can have there dysmenorrhea, headache, etc., etc. Okay, so NSAIDs, please take note lang class ha, NSAIDs do not significantly reduce the progress of rheumatic disease. So, meaning they do not stop rheumatoid arthritis, okay, or any rheumatic disease. Rather, they slow down the destruction of the joints, the cartilage and the bones, and allows patient to increase mobility and the use of their joints. Kasi di ba pag may rayuma ka, halos hindi mo na maggalaw ang tuhod mo, ang kamay mo, because namamaga yung joints. Now, kapag binigyan ka ng NSAIDs, nawawala yung pamamaga, kaya naigagalaw mo siya ulit. So, you have increase in function. Yun nga lang, NSAIDs do not stop the disease progression. It only stops the symptoms. So, are we good? Okay. Now, another use of NSAIDs would be for its analgesic effects. So, they are mainly used for mild to moderate pain. Kapag severe na ang pain, ano nang gagamitin natin? Opioids. Okay, so NSAIDs alleviate mild to moderate pain by decreasing prostaglandin and prostacyclin. While on the other hand, opioids are still more superior than NSAIDs in terms of severe pain. Okay? Now, NSAIDs nga lang are mostly used for muscle pain and joint pains. Okay, for more severe pain, start using opioids. Now, other than that, NSAIDs are also has antipyretic effects. Okay, so NSAIDs reduce elevated temperature with little effect on normal temperature. Now, the elevation of the temperature is mostly associated with its interleukins. Now, the antipyretic effect of NSAIDs is believed to be related to the inhibition of the production of prostaglandin induced by interleukins. So, these interleukins activate the hypothalamus, which causes increase in temperature. So, if I stop these interleukins, bumababa rin yung temperature ko. Pero kapag normal na ang temperature, syempre, hindi niya naapektuhan. Okay? So, are we good? So, here's the summary class of the clinical effects of NSAIDs. And this is actually the last slide. So, congratulations. Natapos din tayo sa ating topic for pain and inflammation. Palakpakan naman dyan. Echos. Okay, so this is the end of our topic. So, if you have any comments, queries, and suggestions, again, you can contact me through my email. That's ldelaluna@cu.l.ph, or you can come to class. Tanungin nyo na lang ako directly. Okay, so again, that ends our session for today. Hope you learned something new, guys. And good luck sa quiz and sa exam. So, thank you very much.